My name is Sandra Hickling. I am one of the co-leads on the patient access team for Expanse, and my focus is on ambulatory front office and community-wide scheduling. Paul, if you'd like to say your EDIT.
Sure. Hi, everyone. My name's Paul. I'm the clinical co-lead for ambulatory and co-lead for the patient portal, and I'm happy to be here to share a little bit about ambulatory.
Thanks, Paul. I'm going to share my screen now. Turn off my camera. Okay, can everyone see my screen okay and its sizing is good? Do we need to make it bigger, or are people okay out there? Okay, not hearing. Alrighty, so we're talking about ambulatory today. So just to identify that ambulatory is a web-based application, and it is accessed through the WPL, so web presentation layer. So how we know that I'm in the web presentation layer, if you look up here at the top left-hand corner on my screen, you'll notice that there's a global icon with the Meditech. So that's letting me know that I am in the WPL. So that's something that you will all become familiar with. So for today's demonstration, I am emulating a clerk. And the facility that we are going to be booking and managing our patient in today is at Collingwood General and Marine Hospital. So when the clerk comes into the WPL, brings up their home screen, to navigate to ambulatory, on my first menu here on the left, we click on ambulatory, and we live in the office staff. Okay, so for today's demonstration, we're going to look at the surgical clinic for Dr. Akinelli. Okay, so this is the schedule grid that comes up for those of you that have been familiar with CWS, community-wide scheduling, looking somewhat familiar to what you see in community-wide scheduling. So I'm going to proceed to book a patient for today so that we can work with the patient. And I'm going to book in, you'll see Thursday, the 29th at the top of the grid. And I'm going to book this patient in at 1300 for today. So it does come up with a prompt telling me, what would I like to do? Would I like a full book, quick book, walk-in, meeting, or reservation? I'm going to make my screen, see if I can make it a bit bigger. Okay, so I'm going to do a full book. It's telling me this time has passed. That's okay. We can say yes. And from here, it takes me into a screen where I can do a search for my patient. So a patient search can be done by first name, last name. I can enter a birth date for the patient. If I had a health card number, I could enter it there to bring up the demographics. So for today's demonstration, so just to let you know, I know that my patient's birth date is 1981. And you'll see that it brought me to Demo AM, which is the patient we're going to be booking. Alternately, I could go, and I'll go down to 1330. I could go full book. And instead of putting, if I didn't know a birth date, let's say all I knew was the first name, last name of my patient, I could put in Demo AM, and it would come up with possible links to that name. So I'm going to choose the name that has been populated. And it's now brought me to the full booking screen. So notice up here at the top left-hand side, I see the patient's name. I see their age, their sex, and their date of birth. It also identifies to me on the right-hand side of the screen in the yellow type comments are demographics for the patient. So if I'm booking in this patient and they happen to be in front of me and I have the information, I can confirm their address, I can confirm their telephone number, I can also go in and confirm insurance. So just as we do in current state, I can do follow-up to verify that the patient I'm checking is the patient that we need to book, and also is there any updates that need to be edited for the patient's demographics. So back over to the left-hand side of the screen, you'll notice that appointment is now got a bluey purple box around it. And I have chosen to book into the resource for the surgery clinic for Dr. Acanelli. If I click on the drop-down arrow, it tells me what appointments can be booked into the clinic. And for today's presentation, we're going to use a surgical consult. It then defaults via the appointment type that this location, so the MIS location is general surgery, identifies the duration and what type of reg type this will be. So this is an ambulatory office visit. Same scenario of everything with an asterisk on it is a mandatory field. So if I was not to put anything in the visit reason, if I tried to book this schedule, it would tell me that I have missed a field and I would need to go back to fill that in. So for today's demonstration, I'm just going to copy and I'm going to paste in the visit reason the appointment the patient is coming to. So because I've booked it off the grid, it's given me my date and my time. And then I can go into here and I can enter the provider. Paul, are you okay if I put Dr. Acanelli and then you will co-sign, or would you like Matos?
You can do Dr. Acanelli.
Okay. So I can put in a partial search and then it will bring me up providers that are close to that fit. And yes, this is Dr. Acanelli that I want to book the patient with. So I've now finished the fields required to enter my appointment booking. So up here in the middle with the two green buttons, I am going to now click Book Schedule. You'll notice now that the patient appears on the grid, their name, their date of birth. If I hit the arrows, it will expand that to provide extra information for me. There's only so much room in the grid plot, but you do have the ability to go into there. So it's giving me my name, my date of birth, my sex, age, what appointment type they're being booked in for, and what status the appointment is at. So currently it's at a book status. Patient's phone number, the provider, and the location that they're being booked into. Okay, so for the demonstration, the patient is here. We're now going to check the patient in. So when I click in the box, you'll notice I get an option to check in. So again, if the patient first time presenting, I still have those screens on my right-hand side in the yellow where I could confirm demographics with the patient. And at this point, I can click check-in. It would like a language. So at this point, I'm just going to put in the field unknown and save. Okay. Check in. And you will now notice on the grid, there's now a green dot that is now displayed on the patient demographics, and that's an indicator that the patient has now checked in. So at this point, I'm going to stop sharing my screen and let Paul proceed with his part of the presentation.
Perfect, thank you. All right, I will now share my screen. And now we'll take you through the clinical side of ambulatory. So once you log on to expense, you will get your main menu. And from here, you will select ambulatory, and then you select clinical home screen. For some staff, you may be required to change your subdivision. So to do so, you would click the subdivision button at the bottom. I'm just going to back out of this. I'm just going to put C for now so you can. So we have the ambulatory facility and the acute facility. So for those users that are logged in and they're coming in through the acute facility, they'll have to change that subdivision to ambulatory. So once you click subdivision, you will get this list. You will select the ambulatory facility, and then you hit OK, and then you can click the clinical home screen. All right, so I'll provide a quick overview of the clinical home screen, but keep in mind that a more in-depth training will be provided. So at the top here, we have the navigation bar, which is always present as you navigate through expense, and it allows you to move to different areas within the system. The first button here on the left side, we have the Return To button, and this allows you to navigate between previously opened windows. So if I click on it here, you will see that I have my main menu, which was the screen I was in before. So I can easily click on main menu to return to that screen. And if I hit Return To again, I can go back to my clinical home screen. Next, we have the Home button. And this Home button basically allows you to return to your clinical home screen as you navigate through the system. So by clicking Home, you will always return to your clinical home screen. And this is useful if you want to see your schedule for the day. There's also other buttons up on top, and you'll get more training or information on those during your training. But workload refers to Meditech's messaging and task system. Okay, so on your schedule here, you'll see that I don't have any appointments listed. So some users, when they do log into the system and come onto their clinical home screen, they might have their appointments listed out for them, primarily physicians, but some users will be required to select the clinic that they will be supporting. So to do that, you would click the down arrow, and then you would search for the clinic from the list, or if you hit Control F on your keyboard, you'll get a search bar where you can type out the name of the clinic, and it will highlight it for you, and then you can select it. So I'm going to select the surgical clinic, which now I see the appointments that I have for the day. Before I talk about the patients that are listed here, I'm going to bring your attention to these windows here on the right-hand side. I have my recently accessed window, which displays patients charts that I have recently accessed. Above here, I have my workload window, which you will find in here all your incomplete or outstanding workload tasks. And down below, I have my quick links, which it's links to sites outside of the organization that may be valuable or helpful to you. And just there's like Gold Care over here as an example, Connecting Ontario. All right, I will now bring your attention back to the booked appointments. So you'll see that I have two booked appointments. The first one here, I have M1, patient M1. And I just want to kind of quickly talk about these icons that you see here. So there may be icons that show up on your clinical home screen. This triangle one is the special indicators icon. So if you click on it, you can see information pertaining to the special indicators. You also have this green icon here, which is messages that are entered by the booking clerks. And then you have The other indicators that will show up here on the right-hand side, this one here with an X, is to indicate that this patient has an imaging order. All right, from here, to access the patient's chart, you would click on their name. Once you're in the patient's chart, there are two primary areas where you can review patient information. The summary tab, which is this section here. It's quite bare right now because this is a new patient and there isn't any information entered. And there's also the reference region on your right-hand side. The reference region, so this column here on the right-hand side, will remain present as you navigate through the system. So as you document, as you enter orders, it will always remain present. This is to keep relevant and pertinent patient information readily available to you. The top portion of the reference region is referred to as the patient header, and this contains the patient's name, age, date of birth, sex, the appointment status, so I can see that the patient is in arrived status, the visit date, so today's date, and the code status. Down below, we have the reference region widgets. And again, as I said earlier, it keeps pertinent information on the patient readily available to you. So we have the special indicators, allergies, problems, medication, outstanding orders, and the PFSH, which stands for patient families and social history, just to name a few. On the summary tab, again, you have customizable widgets that display patient health record information that are most important to you when reviewing and or treating your patient. The tabs above also provide more in-depth information on your patient, clinical information, obviously, such as the patient history, diagnostic results, clinical documentation, patient's demographics, and appointment information. During training, these will be reviewed in further detail. So once you've viewed your patient's chart and you're ready to document, you would simply click on the document button on your navigation bar. From here, you have the option to select the document you require for your clinic below, or you can search for the document by name. I would also like to share with you that you have the option to favorite your documents so that you don't always have to search for them. So if you work on a regular basis at the general surgery clinic, then you can favorite that document so that it's readily available for you. So this can be done by clicking on the star as I did here, or if you're searching for the document by name, you can click on the star in front of the document's name. Once you've done that, I'm just going to quickly show you what will occur. You will only see the documents that you have favorited on the screen. So right now I will click on the document to launch that document. So upon entering the document, you will see these different headings above, and these are we refer to as doc sections. And it's important to note that each clinic has specific documents with specific doc sections pertaining to that clinic. It's also important to note that within ambulatory, nursing, allied health staff, and physicians all contribute to the same document in ambulatory. We're able to view what has been documented by the other staff member, but we are not able to edit their documentation. All right, I will now go through each section and I will document as I go along. So within the intake doc section, staff can view the visit reason. They can capture and confirm the patient's identification. So I'm just going to select name and date of birth. Because lately a lot of clinics have been conducting their appointments virtually, we have the option to capture that here. So if it's a virtual visit, they can select virtual visit to indicate that this was a virtual visit. We also can document and review patient allergies. So over here, you will notice this square with the arrow pointing up. That if we click on that, it's basically gonna launch me into the allergy overlay. And from here, I can document if the patient has allergies, or if they don't have any allergies, I can simply select known allergies to indicate that and hit save. Okay, once I do that, it will indicate that in the document, and it will also display that when the date and by who this was last updated by. And just down below here, we have the active medications, and what that is, it's again, you have the button to launch the overlay, and this will launch the reconcile the overlay where I can reconcile home medications. So from here, again, if the patient had medications, I can capture those here, or simply indicate that there's no medications. If I wanted to add a medication, I would click on the search meds. And it would give me a list of the medications. And I can select it and it would add it to the patient's list. For now, I'm just going to do no known home medications, hit save. And again, it will bring me back to the document, and it will capture that I have reviewed and the home medications. I also have a section to add additional information during intake. And we also have the triage assessment. So one example here would be the COVID screening assessment, which I'll quickly complete. And then we have the section where vitals can be captured. And I'll just put weight. And just put in a height here. Okay. So from here, then I would move on to the health summary tab. And within the health summary is where you would capture the patient's medical, surgical, family, and social history. You could, again, with that button, that square button with the arrow pointing up, you would click on it to launch that overlay, where you can capture any problems, such as an example here. Let's go with asthma, and I can say this patient has asthma, and I can hit save. And now it has added asthma to this patient's medical history. Similar to the other buttons below. Quickly show you the social history. And again, this is standardized across all partners and facilities. So if it's entered here, it will be shared across all modules, as well as across all partner sites. I will now move onto the provider note doc section, and this is where the physicians would be dictating their clinic visit note. So physicians may choose to type out their note or use Dragon software. And so for today's purpose, I'm just going to quickly use the Dragon software, and I'll add a sample. If you just give me 1 second. Visit sample. Sorry about that. Clinic visit sample. And I apologize, it's not working right now. 1 second, I will.
The dictation sure is, Paul, because it's capturing your apology in my documentation.
Yes, it is. Oh, there you go. My clinic sample. There we go. So I have a sample here. I'm not gonna go through this in detail because providers have received some information on this already, and I just want to kind of move along to the next step here below. You will also see that there's a billing code. Providers have the ability to capture billing codes for patients for their patient's visit. This will not be seen on the report output, but this data will be pulled onto a report along with the patient's demographics that can be printed and provided to whomever does the physician's billing. So this is the primarily this doc section is primarily used by physicians. Now moving along to the nursing assessment doc section, and this document section is specific to the general surgery clinic visit. You will notice that there's different queries with so above here, we have a query that is a group response. I can click on it to select a response. And then you will notice that within ambulatory, we have these queries that have, or responses that have a arrow pointing down. This is referred to as a branch. If we click on the arrow, it just means that I can add additional information to this response. So if I selected carpal tunnel release, I can say that it was the right hand. Again, we have some yes, no queries. With that branch, I can say yes, can say local. Again, there's that branch, and I can say that lidocaine 1% with epi was used. If you do not provide a response for a query, it will not display on the report's output. And I'll just quickly fill this in here. And James, while I'm doing this, if you don't mind just going in and documenting something under the wound care, just so that I can share how it looks like when multiple users are documenting. Okay. And I'll just, thank you, James. And then I can say that there was no complaints by the patient today. Okay, and while James is doing that, I'm gonna, again, assume the role of the physician, and I'm gonna enter an order, a medication order for this patient. So to launch the orders routine, I simply select the orders or click on the orders button. And I am now in the orders routine. So this is where medication and non-medication orders such as lab imaging and medication administration orders are entered. And another area where medication reconciliation can be completed. So at the top here, we see manage medication. So we can see that this patient has no known home medications. Because I completed the medication reconciliation through the intake document section, this button is in black font. But if I had not completed the medication reconciliation through the intake, then the font on the reconcile button would be red. And by clicking the reconcile button, it will launch that medication reconciliation overlay. Okay, I will now go back to the orders. And down below, we see manage orders. So this is down here would display any outstanding orders for this patient. I could also click on outstanding orders to see a history of orders that had been entered for the patient. Okay, so from here, I'm going to enter that medication administration order. So I'm simply going to click on the search bar there, and I'm going to enter medication. I'm going to start entering medication, and as you see, the medication admin order is listed there. I can select it, and once it's selected, it populates it with under the manage orders section. I can now click on the chevron next to the name, and then I can select the medication that's to be administered to the patient. So I'm going to select dilaudid, and then once all the required information is completed, and I'm happy with this order, I can click sign and enter my PIN to sign off on the order. Okay, so once the order is entered, communication would occur between the nursing staff and the physician. Another way to know that the order has been entered, if I navigate back to my clinical home screen, so clicking the home button, I will see that there's an O icon, and that's to indicate that there is a medication order entered for this patient. Okay, so I'm going to take on the role of the nurse. Once again, I'm going to click on the patient to launch their chart. I'm going to click back on document to go to the document. And again, once here in the document, and I forgot to mention, once you launch the document, it's important to hit the save button. And when you do that, it basically places the document in draft status and also adds you as a contributor to that document. You also notice up here that Dr. Akinelli has been added as a contributor, and that's because this appointment has been booked under that physician. And you will now see that James is also a contributor of the document because he did document under the wound care doc section. So if I click on this button next to the document name, we call that the preview button. So if we click on it, I can preview the document this far. I will see the provider's note on top, then the information from the intake section, the triage assessment, the nursing assessment that was completed, and James' documentation for the wound care. And you will see that it will list the names of who documented those sections. So because I was assuming the role of the provider, well, it has my name up here, and I completed the triage and nursing assessment, it has my name, but James completed the wound care doc section, and it has his name listed here.
And just a quick point, Paul, if you don't mind me interrupting, to
No, absolutely.
explain for everyone is that, these note types for each of the clinic visits have multiple sections, but you're obviously only responsible for documenting in the sections and what was actually applicable. So for our allied health and our nursing staff that work in these clinics, they know what they document, they know what sections they're responsible for. And our providers themselves, I think 99% of the time, they'll really only be concerned with documenting in the provider note section, like they do today, kind of in their dictation. But it's all just nicely packaged all up in one single note. And anyone can sign when they would like. It doesn't impact when the individual needs to go and sign their document. That's all.
Thank you. Okay, so kind of going back to the order that was entered. So once that order is entered by the medication order is entered by the physician, the information from the order will flow to the office procedure doc section, and the nursing staff can now go in and document the medication administration. So you'll see that that med is populated here, and it has the dose information. I can now go in and state that the medication was given to the patient and how many tablets were dispensed. I'm going to say 1 tablet was dispensed. And you also have a comment field here to add additional comments if required. Okay, once this is completed, you'd hit save. And now under the medications widget on our reference region, it will indicate that that medication has been given to the patient. Okay. From here, nursing and allied health staff have the option to capture any educational material that's provided to the patient. So basically here, this branch is basically a comment field where you can document what educational materials were provided to the patient. And you also have the ability to indicate if a follow-up appointment is required. Below here for referrals, you can indicate any external referrals that were provided to the patient as well. Additionally, nursing and allied health staff have the option to depart the patient at the end of the visit, although this is not required. And what will happen is that the patient will be auto-departed at midnight. So once the documentation is complete and you're satisfied with what you have documented, you're ready to sign off on your document. So to do so, you would click on your sign button. From here, I can see who the additional signers are for this document. So James and Dr. Akinelli. And then I would go ahead and sign by clicking the button, put in my PIN, hit enter, and the document is now in. So if I go back to my clinical screen here for a sec, you'll see that the document is in I-sign status. And the reason why it's in I-sign status is because there's multiple users who are contributing to the document, and it's been signed by myself, but it has not been signed by those other users. So once it's completely signed by all users, it will be in a signed status.
And you can refresh that, and I just signed it.
Okay, I'm not sure because it has Dr. Akinelli linked there. I'm not sure it will change to signed status. But
oh, that's right.
Yeah.
You're correct.
Yeah, it won't. And I also want to point out that once the document has been signed, you can no longer edit what you have documented. The only way to make changes is to add an addendum. So you see this addendum button above. You can click on it to add an addendum to that, to what you've documented below. And kind of going back to the chart, I'm going to go to the providers notes section just to take a look and see how the document flows to the patient's chart. So looking here, I can see the document is listed. It's still in I-signed status. And once it will tell me who contributed to the document. And if I click on this icon, it will give me a preview of the report. Okay, so again, we have the provider note, the intake and triage assessment, the nursing assessment, the office procedure, so that med-admin, departure, and the wound care assessment, and who electronically signed the document, so James and myself. All right. So that's the end of today's demo for ambulatory.